Hello, DelusionDispeller, here to talk to you today about a topic that a lot of people have been asking me about, and I decided to make a video on it, so I did a little bit of research. Now, I'm sure this doesn't cover every area by any means. It's probably going to cover very little, I imagine, but maybe it'll give you some insight. The topic, as the title will denote, has to do with therapists who are narcissistic. And no, my cat is not bored with what I'm saying. I think she's just getting comfortable. This is Me to Me, by the way. We named her Me to Me because when she was born, all she would do is go me, 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 and kind of be pompous, like look at me, look at me, look at me. And Me to Me means look at me in Spanish, so her name is Me to Me. Are you trying to get down, Me to Me? Alright, she may jump over on the bed in a minute. Okay, so as I said, the topic is going to be about, whoops, maybe I didn't say yet, therapists who are narcissistic. Now, I'm not going to say every therapist is a malignant narcissist, but a lot of them have narcissistic qualities. If you remember, narcissists tend to seek leadership positions and authority positions, so it shouldn't be that amazing to hear that a narcissist could be found in a therapy office, obviously, because it just kind of goes with the territory that's kind of the type of thing that they like. I'm trying to find, I just opened my window a minute ago, not my literal window, but my window on the computer where my file is, and now I'm having trouble locating it again. So give me just a moment. This is the right one. Let me get right back to what I was talking about, and there we go. Okay. So here's some of the ways that you can know that your therapist might have some symptoms of narcissistic personality disorder or some traits of narcissism. First of all, a therapist who may be a narcissist or may be narcissistic is often somebody that's well known and someone that is well thought of or comes highly recommended, usually by other therapists, but sometimes clients too. This type of therapist totally controls the conversation and makes you talk about what she or he wants to hear rather than what you feel a need to talk about. When this narcissistic therapist gets fed up with hearing what you have to say, they often show by their body language. They'll stand up, they'll cross their arms, they'll roll their eyes like, are you done yet? They'll mock you. Sometimes they'll just say something very dismissive like, okay, enough on that, or moving right along, you know, that kind of thing. And yeah, sometimes I say that in my videos, but that's me controlling the direction that I want to go, not somebody else. And I hope I don't do that to any client on the phone, because if I'm ever dismissive with you, I would like you to speak up and tell me that, so I don't do that anymore. The narcissistic therapist makes tactless, rude comments like, what's wrong with you? Or any sensible adult would know. Or only a fool would believe that. They are very tactless, in other words. They try to tell you to disown your friends and other mentors that help you. Like, I know somebody personally, I will not mention a name, but this person has been seeing a therapist of a sort who all of a sudden has told this person to stop dissociating with some of their closest friends and other mentors and other people that have advised this person. To me, that's very narcissistic. It's like, this is my ball game and I don't want anybody else giving you any influence or talking to you. Now, there can be a conflict of interest if a person is seeing more than one therapist. That does happen. But I think you have to look at each situation subjectively. If it's not causing a problem that the person is seeking outside help besides the therapist, then the therapist needs to get over themselves and stop being so insecure and so controlling and domineering, and let that person have their free will to talk to who they want to talk to. Because a therapist is not supposed to control you. They're not supposed to you know, tell you who you can be friends with and who you can't, who you can get advice from and who you can't, and that kind of stuff. So anyway, I'm going to keep this down to 5 minutes or so. Stay tuned for the next part.